Unusual vaginal bleeding is any vaginal bleeding that is different from your regular menstrual period. This may include spotting, small amounts of blood between periods, which can often be seen when wiping with toilet paper. Heavy menstrual flow can also be considered abnormal if you need to change your sanitary pad or tampon after it becomes soaked with blood once or more per hour for more than 4 hours. Menstrual bleeding usually happens every 21 to 35 days and is a part of the menstrual cycle. The blood comes from the shedding of the uterine lining which exits through the vagina. This marks the beginning of a new reproductive cycle. A typical menstrual period may last a few days to a week and can be light or heavy. Periods tend to be longer and heavier during adolescence and as a woman approaches menopause. Unusual vaginal bleeding might be a sign of an issue with the reproductive system. This is often classified as a gynecological condition. It may also result from a medical issue or a side effect of medication. If you're postmenopausal and experience any vaginal bleeding, consult your doctor or a healthcare professional immediately. Postmenopause is defined as having no menstrual periods for about 12 consecutive months. This type of bleeding is referred to as abnormal vaginal bleeding, and possible causes include cancers and precancerous conditions, cervical cancer, endometrial, uterine cancer, endometrial hyperplasia, ovarian cancer, uterine sarcoma, vaginal cancer, endocrine system disorders, hyperthyroidism, overactive thyroid, hypothyroidism, underactive thyroid, polycystic ovary syndrome, PCOS, stopping or changing birth control pills, withdrawal bleeding due to hormone therapy. Pregnancy and hormonal factors can play a significant role in vaginal bleeding. Conditions such as ectopic pregnancy, hormonal fluctuations, and miscarriage before the 20th week of pregnancy are some of the common causes. Perimenopause and irregular ovulatory cycles can also contribute to this issue. Sexual activity can sometimes lead to vaginal or cervical trauma from intercourse. Vaginal atrophy, also known as genitourinary syndrome of menopause, is another factor. Infections can also be a culprit, including cervicitis, chlamydia, endometritis, gonorrhea, herpes, pelvic inflammatory disease, ureaplasma vaginitis, and vaginitis. Various medical conditions can lead to vaginal bleeding. These include celiac disease, obesity, severe systemic illnesses such as kidney or liver disease, thrombocytopenia, and bleeding disorders like von Willebrand disease. Medications and devices also play a role. Birth control pills, a forgotten or retained tampon, intrauterine devices, tamoxifen, and withdrawal bleeding due to hormone replacement therapy are all potential causes. Non-cancerous uterine conditions include adenomyosis, where tissue from the uterine lining grows into the uterine wall, cervical polyps, endometrial polyps, and uterine fibroids, which are non-cancerous growths in the uterus. Trauma can also be a factor, such as injury to the vagina or cervix from an accident or penetrating trauma, obstetric or gynecological surgery, including cesarean delivery and, unfortunately, sexual abuse. If you're pregnant and notice vaginal bleeding, contact your healthcare provider immediately. To stay safe, consult a doctor or healthcare professional if you experience any unusual vaginal bleeding. They can determine whether there is cause for concern based on your age and overall health. Seek medical care immediately if you fall into one of the following categories: high-risk cases, postmenopausal women not receiving hormone therapy, postmenopausal women on cyclic hormone therapy. This usually includes taking estrogen daily and progestin for 10 to 12 days each month. Withdrawal bleeding resembling a period is expected, but all bleeding should be evaluated. Postmenopausal women on continuous hormone therapy. Low daily doses of both estrogen and progestin may cause light bleeding. However, if it is heavy or lasts longer than 6 months, see your doctor. Girls who haven't started puberty, including no breast development or underarm pubic hair. Girls younger than 8 years. Any vaginal bleeding in this age group is concerning and requires medical attention. Possibly normal but worth monitoring. Newborn girls may have slight vaginal bleeding in the first month. Consult a doctor if it's heavy or prolonged. Teenagers, irregular cycles and spotting are common in the first few years after menstruation begins. Starting birth control pills. Spotting in the first few months is common. Perimenopausal women, irregular or heavy periods are common, but should be discussed with a healthcare provider.